Good morning. It's Rachel Curtis, the Desert Doula. I am back with Ask a Birth Professional. It's been a little while since we've done an episode, but today I'm really excited. We're going to be talking about a subject that I think is really very poorly understood and underemphasized, particularly in pregnancy and the postpartum period. It is the pelvic floor and pelvic floor therapy. And I have with me Selia Busey. She is a certified professional midwife here in El Paso, and she has also been trained to perform pelvic floor therapy. And she's one of the only people in the area I know who does. So I wanted to be sure to introduce her to you and have her on for this discussion. So good morning, Selia.
Good morning.
Okay, so you had an anecdote about a very extreme form of pelvic floor dysfunction that we talked about opening with. So if you want to go ahead and share that, take it away.
Sure. So after the birth of my first baby, I experienced incredible pain whenever attempting to have intercourse with my husband. And I had no idea what it was. And I didn't have pain at any other point in time. So it was really confusing that all of a sudden I would have this really intense pain despite, all the things they tell you to do when you have a nursing baby, foreplay, use lubricant. But the pain was there and I had no idea what it was. It wasn't for a couple of years that I ended up finding an episode of TLC's Strange Sex where they discussed the condition, which is called vaginismus. And they very adequately described it as a panic attack of your vagina. And it's just the perfect way to describe it, because otherwise it's really hard to that you're like, everything feels fine. And then all of a sudden it's incredibly painful. And that's exactly how it feels. And it's like, it also doesn't make sense because you're like, I'm not opposed to this, but my body is acting like it is. So I finally figured out what it was. For me, it took 9 months before it just kind of went away on its own. But of course, I learned a couple years later that pelvic floor physical therapy is another approach to help treat the problem. And so quite a few years after the training for pelvic floor physical therapy became an option, I was on it. It was definitely something I wanted to do so I could provide the service, because it's very hard to find someone who can do that for people.
Do you have any idea what the incidence of vaginismus is? I've heard it in relation to different kinds of sexual trauma and things like that before. But apparently it can just happen. And explain to us exactly what happens in the body, what's going on. Is it the vagina or what's actually happening?
Sorry, that's my phone. Yeah, so it is the muscles surrounding the vagina will clamp down, and it's just very painful. It's really hard to describe. As far as the incidence, it's considered rare, but it seems like that's mostly because a lot of people don't know what it is to be able to report it. They're just like, oh, I just have pain, and I've known at least a couple people who've had the problem after having a baby. My husband himself, after we learned about the pelvic floor physical therapy and before I was trained, would refer people to a pelvic floor physical therapist in North Carolina, and they had great success. That was part of why I was so eager to do the training when it became available.
Okay, so and I actually did watch the episode, and I put the link in the event description here on YouTube if anybody else wants to watch it. But yeah, what this woman describes is essentially where other people have a hole, she had just a wall. And with her, it was really extreme where her legs would slam shut as well. And so there was just no going through. And yeah, she found someone who could perform. It was pelvic floor therapy to loosen up those muscles and basically get them to relax and open so that there could be penetration. It's pretty astounding. It's kind of an extreme deal.
It is. So that is just one of the things that pelvic floor physical therapy can treat. Most people are not experiencing that when they have the physical therapy done. For a lot of people, it's other kinds of pain that are not as severe. Usually it's more generalized or chronic pain. Urinary incontinence after childbirth is something that can be worked on. And as far as I know, you're interested in using it for pregnancy. In pregnancy, some of the techniques are not advised because they can create such dynamic changes in the body. But one of the ones that can safely be done that is also recommended by spinning babies is the sacrotuberous release. And those are two ligaments they kind of form a V between, like if you're laying on your back, they kind of form a V between your sits bones and near your tailbone. And releasing those will give the baby more room to pass through.
So about between here and here, is that right?
There's one there, and then there's one that comes a little bit lower down for the anterior part. Well, there's one there too.
So they're all over, and then what? Like maybe like here to here?
Yes, exactly. That's the more common one.
Okay.
So the anatomy of the pelvic floor, especially for women, is incredibly complex. There's no one easy diagram because it's made of so many different layers, and each layer goes a different direction. Some are more angled up and down, forward to back, side to side. It's very complex. So part of it, the pelvic floor physical therapy is reaching all those different layers to find the things that might not be so obvious from feeling just like a vaginal exam.
Okay, so let's start with just what is the pelvic floor for? What does it do? What is its purpose? Like what different systems does it, help function?
The pelvic floor is mainly holding up all your pelvic organs, and also, they're involved in walking and sitting and just like many of the other muscles and ligaments in the body. So the functions that most people notice if they have problems with are urinary incontinence, vaginal prolapse, pain with intercourse, or just generalized pain in the pelvic floor.
So like I know in prenatal yoga, like they do a lot of, they have different things to kind of like help balance and stretch your pelvic floor. And one of them is the way that they tell you to do it. I mean, because Kegels are pelvic floor exercises, right? And the way that that's kind of described is to like try to pinch off, if you're going to the bathroom, what would you do? And it's engaging those muscles. So can you tell us like about Kegels?
So Kegels are over recommended. They are useful for toning certain parts of the pelvic floor, but the problem is it overtones only certain parts, and then you're left with imbalance. It's really important to do squats to balance out those muscles that are toned with Kegels, because otherwise, when you're doing a Kegel, it's pulling everything tight together, but then all that does is pull your bones in closer. So a lot of women will have their sacrum pulled tight, their tailbone pulled in tight, and then they just have a narrower opening or outlet for their pelvis. And the squats help pull that sacrum and tailbone back to where they're supposed to be.
Okay, so Kegels kind of pull this way, like from front to back? Okay, and then when you squat down, it kind of helps pull all this back out again.
Yes, exactly.
Okay. So yeah, I mean, when you're going to the bathroom, the muscles that you're using to like control the flow, and that's number one and number two, right? That's all the pelvic floor, right?
Yes. So there are muscles that form a little loop. One goes around just the urethra, one goes around the urethra and the vagina, and one goes around the urethra, vagina, and rectum. So there's loops for all of them. And so that engages those, but there's so many more muscles that are not engaged with that exercise. So it's important to do a variety to get some balance.
Okay. So before we talk about what you actually do to help that, when there is an imbalance, you've got some that are tighter and some that are looser. What is the role of the pelvic floor in childbirth?
Of course, in childbirth, the pelvic floor has to do the opposite of what we do most of the time, which is be tight, and it has to relax to allow the baby to pass through.
Mm-hmm. So when we did, well, and you did spinning babies with me. So one of the things she was talking about was how tightness or imbalance in the pelvic floor can also kind of determine the baby's path, through down, their descent down to the birth canal, and which way they might turn or tuck their head, and that can then also impact just the course of labor and how the position that the baby is as they come down.
Sure. And that's one of those ones that sacrotuberous ligament is one of the most common places that it's tight and causes a hang up for baby. And that's right down at the bottom. So that's usually what's going on when you have a baby that comes right down to the bottom and then gets stuck.
Mm-hmm. Okay. So, for all the pregnant mamas out there, even if you're not doing pelvic floor therapy, doing the squats, doing the Kegels, not too much of one or the other. And there's a few other releases that you need another person to do, but keeping that pelvic floor in condition is really important, because it's just this big web of muscles that baby has to get through. So let's talk about what actually happens if someone comes in for pelvic floor therapy. And do you recommend it prior to birth?
I recommend it if someone's having particular pain. Pain, of course, is not uncommon at the end of pregnancy, especially if baby's head is pressing on a nerve. That might be normal. But if someone's having extra pain, like more than you would consider to be common aches and pains, then it can be helpful to release any tight muscles. One of the parts of pelvic floor physical therapy called myofascial release is not recommended because the effects can be so dynamic. The myofascial tissue runs all throughout our whole body. And so they consider, let's just not do this just in case it maybe starts labor prematurely or something like that. So that one's not recommended, but you can do the releases for the ligaments and the muscles, and that can help if there are nerves being pinched or anything like that. When someone comes in, we first discuss, what kind of pain they're having, so I can figure out which area I should probably checking, because, of course, it is such a complex part of the body. You can't really reasonably check every single little thing in one session. It would just be overstimulating to the body. So instead, we try and do it more targeted based on where they're having pain or what types of pain they're having. The therapy itself is intravaginal, meaning it's a gloved hand, and you use a finger in the vagina to release these different areas of tension.
So what is that like when you release it? What does that involve?
That's a good question. It's using pressure. So you just hold like some gentle, steady pressure on specific points. And when those muscles and ligaments feel that pressure, they relax in order to prevent damage. So very much like when we're talking about in childbirth, you need to like relax your pelvic floor to help prevent tearing. Our body has that mechanism in place already, so that when it senses extra pressure, it will release in order to prevent damage. So we're just taking advantage of the body's natural mechanics to release muscles that have, for some reason, decided that they need to be overly tight.
Mm-hmm. Well, and I think a lot of it too has to do with, lifestyle and how we sit. You talked about that sacrotuberous ligament. We sit on our sacrums all the time. So, the body adjusts around that position. But yeah, and I've heard discussions of just all kinds of any kind of injury to the pelvis or something like that can sometimes kind of tweak things and throw them out of alignment. So, but yeah, I remember I had you come out, and I went to actually watch a pelvic floor session with a client who was having a lot of pain, and she was having trouble even just, she said when she would get up out of bed, when she would swing her legs over to get up out of bed, and she reported immediate improvement, like while we were right there in the room. So anyway, I highly recommend it. Do you want to tell us just a little bit about how someone would get in touch with you, how it works if they were interested in having you come out and check?
Yeah, so email or Facebook Messenger both work really well, because if I am sleeping during the day after a nighttime birth, then it won't wake me up. So those are preferred, and I can send you my information so you can post it in the link the episode.
Okay. And yeah, Celia's on Facebook. She's at Blissbirthsmidwifery. So she's pretty easy to find. And then we also have another colleague of yours in Las Cruces, a friend of both ours, actually. Also, she did the training with you. And tell us a little bit about the training, actually. How long was it and what kind of stuff did you do?
It was 3 8-hour days. And the entire time it was very intense training. It wasn't a slow pace. It was very much go, 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 go to get it done even in 3 days, because the pelvic floor is so complex and there's so many structures to address. So the training itself, we would learn about a specific part of the pelvic floor, and then we would practice releasing it on each other.
I mean, yeah, how else are you going to figure out what that feels like?
Yeah, and I thought I wouldn't need it because I felt like I didn't have any particular pain associated with my pelvic floor, but I found that despite thinking everything felt fine, I felt so much better after having the work done.
Really? So even you noticed a difference even though there wasn't any particular problem or issue?
I did.
Okay. And then, so the woman that you did it with is also a home birth midwife, and that's Sara Ames Sanchez. She's up in Las Cruces, and hers is Homegrown Midwifery.
That is correct.
Yes.
Mm-hmm.
Okay. And do you both have websites?
Yes. I'm not as active on my website because most people find me through Facebook.
Okay.
But yes, we do have websites.
Okay. And then about how much does a session cost and about how long does it take?
So most pelvic floor physical therapists charge a lot more because, that's their main profession. I charge a lot less just because I'm trying to make it accessible to people, and because most of the people in El Paso who need it are lower income, and insurance may or may not cover it with a physical therapist. So I usually charge $25 for a session, and I do the first one free so people can try it out, see if it's something that they like before committing to it.
So does it usually involve several sessions then?
It depends. Sometimes someone will have something that's tight and you release it and they're all set. Sometimes you need to do it a couple times because after releasing it, sometimes it'll re-tense up again.
Okay. And so how long does it usually take from the time you walk in their door to the time you leave, more or less?
We usually chat for several minutes first, and then the actual treatment is usually 10 to 20 minutes.
Okay. Well, great. Thank you so much. I'm really excited to have this information out here. Like I said, I didn't know anybody to send people to, and I tell everybody about Selia now. Yeah, thanks very much. And that's our session for today, and we will see you again soon. Thank you, Selia.
Bye.